when I first started in radiology, sometimes reports would be 5 words. You would just answer the question and that was it. And now knowing that somebody else is reading, knowing that you maybe have a layperson reading, sometimes will do things to cater to that audience. But I think it's hard to really cater to a lay audience simply because the terms we use are exact. They're meant to describe phenomenon to the doctors that are directly taking care of patients in the setting of most of diagnostic radiology. And so one of the things we've looked at actually is how do we create a lay version of a radiology report? How do we create a radiology report that works for the doctor that needs to read it, needs to understand the exactness of what's going on, but at the same time explains it in terms that a layperson can absorb? I think it's hard. I think that's one of those areas where I do think technology can help us there. You can have a physician really speak to another physician, but you can have a product that can put that in lay people's terms. And I've actually heard of patients taking some of our reports and putting it into Claude or ChatGPT or one of the other AI products to punch out, like, what does this mean? And maybe it's helpful, maybe it's not. But I do think that's probably the future. I think people want to be invested, and we frankly want people to be invested in their care. I think somebody who's invested in their care, who's thinking about what's going on, is going to make better decisions than somebody who's not.